The objectives of this presentation is to define substance abuse, inform on the negative effects of substance abuse, and provide information and learn how to identify substance abuse. According to Merriam-Webster Dictionary, abuse is the excessive use of a substance or use of a substance without medical justification. Drug addiction is an uncontrollable desire to use drugs. About 570,000 people die in the U.S. annually due to drug use. About 20,000 are due to illicit drugs. The short-term effects for marijuana use is a slow reaction time, loss of balance and coordination, increased heart rate and appetite, anxiety, and trouble learning. Long-term effects are mental health problems, frequent respiratory infections, and chronic cough. Prescription drug abuse in the U.S. Commonly used and abused prescription drug abuse include opioids, depressants, and stimulants. Nearly one-third of people aged 12 and older who used drugs in 2009 began by using prescription drugs for non-medical reasons. Side effects from prescription drugs. Opioids. People who abuse opioids drugs may feel drowsiness, depressed breathing, and constipation. For stimulants, they have a strong effect on the cardiovascular system. It can raise body temperature and increase heart rate. For CNS depressants, it slows down brain activity, causes sleepiness, and loss of coordination. Different treatment methods. Always begin by talking to your primary care physician before starting any treatment plan in order to find which plans fits you best. Behavioral treatments, use of counseling to change behaviors that might cause alcohol abuse, mutual support groups, programs utilize peer support for individuals who are seeking help with their substance abuse problems. Medications, naltrexone used to help reduce heavy drinking, acetylprostate assists in maintaining abstinence, and disulfiram blocks the metabolism of alcohol, causing unpleasant symptoms such as nausea and flushing of the skin. Tobacco abuse. 440,000 people die from diseases related to tobacco. In 2013, 17.8% of people who smoked cigarettes in the U.S. Adults who lose an average of 13 to 14 years of their lives. Tobacco is the leading preventable cause of premature deaths in the U.S. Cigarette smoking causes 1/3 of all cancers, including 9% of lung cancer cases. Exposure to secondhand smoke causes 41,000 deaths per year to non-smokers. Smoking also causes strokes and cardiovascular diseases. Mothers who smoke during pregnancy hurt their baby's lungs, and exposure to secondhand smoke causes 41,000 deaths per year to non-smokers. Treatment of tobacco abuse. Nicotine replacement, patches, gums, and spray, prescription medication, and individual therapy.
Alcohol abuse. Nearly 88,000 people die from alcohol-related deaths in the United States annually. Excessive alcohol use is characterized by drinking 5 or more drinks on an occasion for men or 4 or more drinks on an occasion for women. The heart effects of alcohol abuse include cardiomyopathy and arrhythmias. Effects of the liver include stenosis or fatty liver, alcohol hepatitis, fibrosis, and cirrhosis. Alcohol abuse also increases mouth, throat, liver, and breast cancers. Fetal alcohol spectrum disorders is a term for multiple diagnoses. Drinking while pregnant may cause fetal alcohol syndrome, which leads to a variety of cognitive and behavioral problems. Signs of a problem with alcohol. If you answer yes to 2 or more of the following questions, you may be at risk of alcohol abuse. Have there been instances when you drank more or longer than you intended? Have you ever experienced cravings or a strong urge to drink? Has drinking caused problems with your family or career? Have you tried to quit or cut back on drinking but failed? Do you need to drink much more than you once did to get the desired effect? Or do you ever continue to drink even though it makes you feel anxious or depressed? Drugs in the U.S. In 2011, 12,480,899 people were arrested for drug-related charges. The percent of persons 12 years of age and over with any illicit drug use in the past month is 9.4%. The percent of persons 12 years of age and over with in non-medical use of a psychotherapeutic drug in the past 12 months is 2.5%. In the U.S., 23.2 per million persons 12 years or older needed treatment for drugs, but only 2.4 million people received treatment.